Hello, my name is Dr. Joseph Daniel. I'm a board-certified plastic surgeon in Greenville, Delaware. I'm approximately 30 to 40 minutes from Philadelphia and just a few minutes from downtown Wilmington. What we're going to do today is talk about fillers, the common fillers being Juvederm, Restylane, Perlane, and Radiesse. And then we'll have another separate video for Sculptra. Fillers are interesting materials. They have been around for many years. The original filler was collagen, and collagen, as well as the other fillers, are used to fill lines or to add volume. So most common areas patients come into the office for treatment are the deep nasolabial fold, or also known as the laugh line. The crease from the corner of the mouth to the chin is called the marionette line. The hollow between the chin and the jowl is called the prejowl sulcus, and that can be filled in to blend the appearance of, or diminish the appearance of the jowl coming to the chin. And then, of course, it can be used for augmentation for volume, either for a hollow cheek area or highlighting the bony cheek look, or just filling in the cheeks below the actual cheekbone. I prefer to use non-permanent fillers. Permanent fillers, such as Articol or Artifill, are used in the same way, but have problems with their permanency. So, for instance, if it's not perfectly injected, or you develop an infection, or your face changes as you age and the filler is now in the wrong position, it's very difficult to remove. So having a long-acting temporary filler allows you to change as you change. If there's problems, they're temporary, and they generally work very, very well. Juvederm and Restylane are called hyaluronic acid fillers. Hyaluronic acid is a natural substance in our bodies, so allergies are basically non-existent, and both materials are manufactured, not animal-derived. Radiesse, I'm sorry, this is a syringe of Juvederm. It's basically a very clear material and looks like and acts like a watery gel. This is Radiesse. It has a white appearance in the syringe, but in the body it is not white, and also works well. The differences between the two, Juvederm and Radiesse, are likely to last anywhere from 6 to 9 months. They're suitable for use in the lips, folds, and sometimes for minor volume requirements, and even for acne scarring. Both of those are injected with just topical numbing cream, and for the lip, I prefer to use additional measures to decrease pain, such as numbing inside the lip with a small amount of injection, so that the actual procedure is completely painless. Radiesse is injected slightly deeper in the skin, and its duration is likely to last about 12 months. It feels very natural, and it has a slightly more powerful lifting effect for exceptionally deep folds here, or it can also be used, I think, better for areas for volume requirements. It, however, cannot be used in lips, and does not perform properly in lips for volume. So depending on what the problem is and the goals, one of these materials is a great choice, and sometimes all three together. There is another material called Sculptra, which is also a filler. It is a material that acts differently than the others in that it is a framework to add new collagen. And so therefore you are actually growing new tissue of your own to augment volume. It is not a line filler, but basically a volume filler. So for instance, in the cheek, below the cheekbone, along the jawline, or even the whole area, just to thicken the skin and prevent lots of the wrinkles that develop with smiling. It is more expensive than the others. Treatments for Juvederm and Restylane are typically in the $500 to $800 range. Radiesse tends to be in the $700 range, with Sculpture being anywhere from $1,000 to $2,000 per session, with the advantage of Sculpture being that it lasts twice as long, sometimes 2 to 3 years, and the amount of volume that you can achieve is substantially more than the other fillers. So it's unique in its properties and does have advantages, but most patients seem to fit well with the more traditional fillers of hyaluronic acids or Radiesse. In terms of the actual procedure, consultation is usually done separately, but sometimes the consultation and procedure can be done the same day. I like to ask that patients avoid aspirin or Motrin or other antiplatelet type medications to minimize the chance of a bruise. Bruises can happen, and they're really just more of a nuisance and can usually be covered by makeup, but it's nice to have essentially no cosmetic downtime with a simple office procedure. I did neglect to mention that another area for fillers is the tear trough area at the cheek lower eyelid junction. And instead of having a blepharoplasty to remove fat, sometimes adding volume to the deficit can make a nice improvement. And again, as it relates to downtime, lower eyelid injections do usually produce some sort of a bruise. So preventing aspirin type products approximately 1 week before the surgery or procedure is preferable. Both Radiesse and Juvederm tend to take approximately 10 to 15 to 20 minutes to perform. You leave the office with a little bit of redness along the injection zones. Ice usually done that day, and without a bruise, return to work or home with really no visible appearance that anything was done other than the new, improved, and lack of fold that we were treating.